Hello guys, welcome to Haelsoft EdTech. My name is Dr. Ezeadichie Emmanuel Chinedu, and I'm going to be your tutor for today's course, Body Cavity in Veterinary Anatomy. The learning objective for today's course will be these that are listed here, because I want at the end of this course, each student who watched this video, who partake in this learning process, should be able to define what a body cavity is, identify the major body cavities in the body of an animal, describe the subdivisions of the thoracic cavity, explain the mediastinum, describe the peritoneal cavity, and with all the knowledge you have gotten from this course, you should be able to apply the cavities in anatomy clinically. Because if you can't apply it clinically, then it means you have not really understood what we were trying to teach. Now, the image on this slide is the image of the entire cavities in a dog's body. We'll be dividing this lecture into two, the part A and the part B, because I don't want it to be long. Body cavities are internal spaces that contain, protect, and support the organs of the body. So they are trying to tell you that the internal organs in the body of an animal is found within a space, an internal space in the body. And this internal space helps to contain these organs, to protect them from what? Pressure, to protect them from what? Friction, so they will not be what? Gliding against one another or hitting the what? The lateral aspect of the what? The internal the body, the walls of the body. So these cavities are very essential for protecting what? The splanchnic organs. We have a whole lot of cavities in the body, but the most important ones are the ones I'm going to be listing out here. We have the thoracic cavity, we have the abdominal cavity, we have the pelvic cavity. Now, within the thoracic cavity, we also have some subdivisions where we'll be talking about the what? The right pleural, the mediastinum, and the what? The left pleural. Now, there are also other cavities in the body aside these cavities that I have listed below. We have the cranial cavity, but these are not really essential cavity when talking about body cavities in veterinary anatomy. Now, the cranial cavity is found within the skull. When you hear the word cranial, you know, towards the skull from our what? Description terms. So the cranial cavity is found within the skull, okay? And that is what houses the what? The brain. While the vertebral cavity is found within the vertebral column, which houses the what? The vertebral, the spines, the spinal cord, the vertebral column. That's when you talk about the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, and the coccygeal what? Vertebrae. So the vertebral cavity is what houses this what? Vertebrae. So the cranial cavity, the vertebral cavity are all also part of what? The cavities in the body. But the essential ones are the what? The thoracic cavity, the abdominal cavity, and the pelvic cavity. Now, like I said, that a body cavity is an internal space that contains and protects organs in the body. Now, when you come to the functions of body cavity, you need to understand the roles that body cavity plays within the body. The first one is protecting the what? The organs of the body. Now we know the heart is one of the most essential organs in the body. and the heart is found within the what? The thoracic cavity. Now, aside being found within the thoracic cavity, it is also housed in the mediastinum. Okay? Another function is what? It allows organ movement. Trust me, don't think that your heart being found in the mediastinum, that it does not really move just a little. The body cavities allow space for what? Gradual movement. Because if you know that the heart pumps, why pumping blood? It pumps just gently. You understand? It is because the heart is found within a what? A cavity that allows those small movements. And it reduces what? Friction. So there will not be what? Gliding of the heart, gliding of the lungs among what? The wall of the what? Of the thoracic what? Cavity. It won't be gliding against anything. You understand? And it helps to what? Organize the body structures. You see the way we have the thoracic cavity, we only have the lungs there and the heart there. We have the abdominal cavity, we have the stomach there, we have the liver there, we have, part of the kidneys are there. We have the pelvic cavity. Okay, so you see how important these what cavities play in the body, housing various important organs in the body. Okay, and these three are the major cavities that veterinarians routinely discuss when you hear them what interact with each other. Okay, the thoracic cavity in dog is the body cavity that is located within the thorax. Now, when you hear the word thorax, they are just telling you the chest. And as a veterinarian, you have to what? Know the boundaries that are bounding every aspect of what? Any structure you are learning in veterinary medicine. And this thoracic cavity is bounded by the what? The thoracic vertebrae dorsally. Remember our lectures on what? Body plane. Dorsally means what? When you say dorsal, it means towards the what? The back. When you say lateral, it means away from the what? The median plane. And when you say ventral, towards the belly. Okay? And when you say caudal, it means towards the tail. Because we're about to apply this knowledge here now. Understanding the thoracic cavity, you should understand the boundaries as well. So I'm going to put in a mark here so that I will be able to also what? Explain these things for you. Now, the thoracic cavity is bounded dorsally by the what? The thoracic vertebrae. Now, as you can see, these are the thoracic vertebrae. Let me change this color from yellow to what? To white. These are the what? The thoracic vertebrae. Okay, and it is what? This is the thoracic cavity here. As you can see, this is the thoracic cavity here. Okay, this is the thoracic. It's also part of this place. No, it's not. This one is far away. It's also part of this place. Yes, this is it. And this is the vertebral column. The thoracic cavity is bounded dorsally by the what? The vertebral column. And laterally by what? Both ribs. Both ribs. Because the ribs is on both the right and the what? The left axis. And remember, lateral is away from the what? The median plane. So the ribs is bounding the thoracic cavity laterally. And ventrally by the sternum. This is the what? This is the sternum here. Are you seeing it? This is the sternum. Okay. It is what is bounding the what? The thoracic cavity ventrally. And what? Caudally by the what? By the diaphragm. Now, the diaphragm is usually found around this region. This image is overextended. Okay. Let me put this thing back. The diaphragm is usually found around this region, okay? Yes. So it is bounded caudally because the diaphragm is moving towards the tail, okay? and it is bounded caudally by the diaphragm. So if you check this image clearly, you will understand what the thoracic cavity is. It is that cavity, that internal space that is found within the thorax, and is enclosing important organs. Okay, and the subdivisions of the thoracic cavity are not really that much. You need to also understand the subdivision, because your knowledge of the subdivision will go a long way in the practice. Now, the thoracic cavity is divided. I will go back to this image. The thoracic cavity is within the chest, with the boundaries, the thoracic vertebrae, the ribs, the sternum, and the diaphragms. Okay. But then the thoracic cavities contains a whole lot of important structures. One, it contains the heart. Within the thoracic cavity, you will see the heart. And also the pericardial fluid, because the heart has a peritoneal sheath that surrounds it. You understand? Within that sheath is a tiny fluid, that helps to prevent friction. So the heart is found within the thoracic cavity. The lungs, that helps to gaseous exchange for the animal, is found within the thoracic cavity. Each is enclosed by a visceral pleura. The visceral pleura is a thin sheet, but we'll get there. And the thoracic wall is lined by the parietal pleura. Is also just a thin sheet. The fascia that is resting on the lungs itself is the visceral pleura, while the fascia that is having contact with the thoracic wall is called the parietal pleura. So each is what protecting the lungs from that friction that we talked about. But then the organs that are found within the thoracic cavity are the heart, the lungs, the trachea, the esophagus, and the major vessels. When we talk about the aorta and the other vessels of the heart. Now, as you can see, this image here is talking about the subdivision of the thoracic cavity. Okay. In that thoracic cavity, if you cut an animal transversely, you would see this. You will see the left pleural cavity. This is the left pleural cavity. Yes. And the right pleural cavity. And you also see the mediastinum. You see this? This whole place is the mediastinum. And the pericardial cavity. Now, the pericardial cavity is where the heart is found. Okay? Now, the right pleural cavity is what surrounds the right lungs, and it contains a small amount of pleural fluid. Now, this is the right cavity. It contains the right lungs, and inside it are two fascias that are protecting the right lungs. And inside this fascia, the one of the fascias that is resting on the lungs is called the viscera. When you hear the word viscera, they are talking about organ. Now, fascias are thin, transparent tissues that that protects an organ. So that tiny sheet that rests on an organ, all of them have it. The kidney has it, the heart has it, the lungs have it. Okay, so the one that is directly resting on the lungs itself is called the visceral pleura. And these fascias comes in two. So that in between the fascia is what you found a fluid that is ensuring no friction in the animal's organ. Now, why the fascia that is also resting on the wall of the thoracic cavity? When you hear anything wall in veterinary practice, they refer to it as parietal. So the fascia that is resting on this wall of the thoracic cavity is called the parietal what? Fascia. And within it is a tiny fluid that is called the pleural fluid. Now, it is this fluid that prevents what? Friction within the right lungs. It also does it within the left lungs. Okay, so these are the major subdivisions of the thoracic cavity, which includes the right pleural cavity, the left pleural cavity, the mediastinum, and the what? The pericardial cavity. Now, going back to this image, I needed to explain to you the clinical importance of these cavities that we are talking about here. Now, for the pleural cavities now, conditions that include pneumothorax, you heard the word pneumothorax. Now, these conditions would not really be appreciated if you don't have good knowledge of what? The body cavities of an animal. Now, pneumothorax, which is air in pleural cavity, air in pleural cavity, while hemothorax is blood in pleural cavity. So when there's blood in the pleural cavity, is referred to as what? Hemothorax. And pyothorax, when there's pus in the pleural cavity. And pleural effusion, which is fluid accumulation. Now, your knowledge of the pleural cavity will be what will help you in what differential diagnosis of all these conditions in an animal. Because once there's hair within the thorax, you should be able to examine, because you know where the thoracic region is, you examine what the thoracic cavity is, you examine the animal properly, and what distinguish if it is air that is there, if it is blood that is there, or pus, and you know what to treat for. The same thing with the mediastinum. Conditions like lymphoma, thymoma, esophageal disease, okay? Your knowledge of what thoracic cavity would help you what diagnose the conditions in this animal effectively and faster, because you already know where they are located, and once you start seeing those cancerous cells, you know how to locate it and how to effectively treat it if it is treatable. And also in the pericardial cavity, conditions like ascites, not ascites, like cardiac tamponade, pericarditis, which is inflammation of the pericardium. You understand? When the pericardium is inflamed. Now, as a veterinarian, you should know the normal, because they will always teach us the normal and what the abnormal. So when you now notice that it is inflamed, the knowledge of where the mediastinum is would help you to what detect what is wrong with the animal. Why is the pericardium inflamed? You understand? So you see, all these cavities are important because there are so many diseases about. Now, we talked about the pleural cavity, okay? Each lung occupies its own pleural cavity, which is the right lung, the left lung, that has the right pleural cavity and the left pleural cavity. And each of these cavities is lined by what? Pleura, which consists of what? Parietal pleura, the lines the thoracic wall, just like I explained, the visceral pleura that covers the lung surface itself. And between them is what? The pleural space. And the clinical importance of the pleural cavity is what these diseases include pneumothorax. So you should know these diseases because these are the diseases that affect the pleural cavity, which include in the pleural cavity, hemothorax, pus in the pleural cavity, pyotorax, pleural effusion, which is fluid accumulation in the what? In the lungs or the pleural cavity. And this will be the end of this course, the part one of this course. So on our next video, I'm going to be talking about the part two, which include the what? The mediastinum. Remember from our learning objective, defining a body cavity, it includes what? It is the internal space within an animal's body that helps to contain, protect, you understand? It contains and protect what? Internal organs in the body and prevents what? Friction among these organs. Okay? You should be able to identify the major body cavities. And the major body cavities include the thoracic cavity, the abdominal cavity, and the what? The pelvic cavity. Also, you should be able to describe the subdivisions of the what? Thoracic cavity. The thoracic cavity has about 4 subdivisions: the right pleural cavity, the left pleural cavity, the mediastinum, and the pericardial cavity. Now, on our next video, that's when we'll be talking about what? Explaining the mediastinum, describing the peritoneal cavity, and applying cavity anatomy clinically. So thank you once again for joining us on this video. My name remains Dr. Ezeadichie Chinedu, and I should be seeing you on our next video where I'll be talking about what? Mediastinum and abdominal cavity and pelvic cavity. Thank you so much.